Greetings. Hello, everyone. Thank you for joining us and welcome to a conversation with congressional champions for suicide prevention, honoring their legacies and looking ahead. My name is Laurel Stein, and I am the Executive Vice President and Chief Policy Officer at the American Foundation for Suicide Prevention, AFSP. AFSP is the largest nonprofit organization dedicated to saving lives and bringing hope to those affected by suicide, including those who have experienced a loss. We are headquartered in New York City with a public policy office in Washington, D.C., and chapters in all 50 states, D.C., and Puerto Rico. I am joined today by Emily Feltrin and Joanna Rosen from the Public Policy Office. We are so honored today to be having this conversation with Congresswoman Grace Napolitano and Congressman Tony Cardenas, two remarkable congressional champions for suicide prevention and mental health who will be leaving Congress at this end of this year. So today, during today's webinar, you will hear reflections from both members of Congress, followed by a roundtable discussion, and then we will have time for questions at the end. Please feel free to submit questions via the question pane at any time, and our staff will receive them there. Today's webinar is being recorded and also will be shared. Before I begin my introduction of our esteemed speakers, today's October 8th webinar is being held as we recognize National Hispanic Heritage Month, September 15th through October 15th. And I thank everyone for joining our efforts to fight suicide and raise mental health awareness among diverse Latino, Latinx, and Hispanic communities. Now, I have the distinct honor of introducing Congresswoman Grace Napolitano. First elected in Congress in 1998, Congresswoman Napolitano has proudly served the people of Los Angeles County for 26 years and is currently in her 13th remarkable term in Congress. Congresswoman Napolitano represents California's 31st district, which covers several cities and communities in the San Gabriel Valley. Napolitano is the highest ranking California member and Hispanic member of the U.S. House Committee on Transportation and Infrastructure, where she serves as ranking member on the Subcommittee on Water, Resources, and Environment. Notably, Representative Napolitano is the founder and co-chair of the Congressional Mental Health Caucus. She has been active in securing mental health parity in the Affordable Care Act, promoting health legislation, and working with prominent figures to increase funding and access to mental health services in Congress. Her 2001 program providing mental health and suicide prevention services on site in 4 schools has expanded to 35 schools with assistance from Los Angeles County Mental Health, which now serves as a model program for the Mental Health Services for Students Act, which is HR 3713, which has co-sponsored by 130 legislators. After the tragic Newton shooting in 2013, Congresswoman Napolitano was appointed to serve as a vice chair of the House Democratic Gun Violence Prevention Task Force to ensure mental health has remained a critical part of the conversation on gun violence prevention. She remains deeply committed to continuing to reduce the harmful stigma related to mental illness and educating all public officials, communities, and families on mental health warning signs and symptoms, with the overarching message that it's always okay to seek help. Congresswoman Napolitano is also a member and former chairwoman of the Congressional Hispanic Caucus, which addresses the impact of national issues, including mental health, on the Hispanic community. AFSP was honored to recognize Congresswoman Napolitano in 2010 with our Allies in Action Congressional Award, and in 2023 with the 988 Crisis Response Champion Award with our friends at the National Alliance on Mental Illness, for her tremendous leadership in support of the establishment of the 988 Suicide and Crisis Lifeline. Congresswoman Napolitano, I am so pleased now to turn to you for reflections.
Thank you very much, Laura. It's a thank you to the American Foundation for Suicide Prevention for inviting me and my good friend, colleague, Tony Cardenas. I have been incredibly proud to serve as the founder and co-chair of the Congressional Mental Health Caucus, where we have worked to ensure that other members of Congress are able to put out information that they know affects people, all children, all adults, adolescents. We work to promote access to mental health for children and adolescents, improve mental health resources for veterans and seniors, and increase mental health coverage for everybody. The caucus is a forum for members and their staff to work together to share ideas, specifically promote them. And Joseph puts out newsletters where he shows all the legislation being considered. Be sure you tap into it. We hold promotional events, informational events to raise awareness of critical mental health issues. We promote bipartisan mental health legislation to reduce stigma. The caucus also holds several briefings, roundtables, and events through the year, including May Mental Health Month. For over 2 decades at the helm, we've been very, very proud to grow the caucus, as you said, to 106 members. Thank you to my colleagues for working with us on this very important issue. But I want to thank my great co-chairs in leading the effort, who former Representative Katko, who focused on suicide prevention. Unfortunately, he had to leave. And now we have Ron Byer and Andrea Salinas, and they will be choosing the Republican counterparts to lead the caucus. After learning that 1 in 3 Latina adolescents, ages 9 to 11, had contemplated suicide, we secured federal funding to create a pilot project on site, started with 1 high school and 3 middle schools for mental health services and suicide prevention services for students. With assistance from LA County, the program is now expanded and is 35 schools. And as you said, it serves as a model for HR 3713, Mental Health Services for Students Act. We still don't have a schedule for passing, but I'm still hoping that we're able to get it. In my district, I also founded and worked closely with 31st District Mental Health Consortium, a dedicated group of mental health professionals. Advocates meet quarterly to discuss and share mental health related information and advise my office on public mental health policy and related issues. The person who leads it is a counselor, a rabbi, and a mental health provider, Irma Diaz. As I look back in my career, I've been fortunate to secure mental health parity in the Affordable Care Act and introduce legislation to address behavioral health treatment and workforce shortages, mental health services for students, mental health needs of asylum seekers, and increased funding and quality assurances for 988 and Suicide and Crisis Lifeline, plus the outreach strategies to Hispanic and Latino communities. Although I am retiring, I plan to remain deeply committed to continuing to reduce the homicide stigma. It's got to be addressed. And I implore everybody to reach out to their elected officials to make them aware of how it impacts their area and how they can be part of changing that culture to have mental health be considered as a health issue, just like any other issue. Just glad to be here today with you, and I look forward to talking to everybody.
Thank you so much, Congresswoman Napolitano, for those inspiring remarks. You truly have been a champion for suicide prevention and mental health over so many years in Congress. And it's been an honor personally witnessing your leadership for much of my advocacy career and working with your current and former staff, Joseph Soni, Jonah Cunningham, Anya Romero, and many others. I now have the pleasure of introducing Congresswoman Tony Cardenas. Raised by hardworking immigrant parents, Congressman Cardenas was brought up with simple ideas that integrity and dedication were the keys to success. These are the qualities he has brought to his work as a public servant, and he continues to offer that today as a United States Congressman. Representing the community that raised him, Congressman Cardenas has never stopped working for the San Fernando Valley, from fighting for better jobs to lowering costs. Before representing California's 29th district in Congress, Representative Cardenas was first elected to the California State Assembly in 1996. He went on to serve 3 terms in the Assembly and was later elected to the Los Angeles City Council in 2003. Congressman Cardenas made history as the first Latino elected to represent the San Fernando Valley in Congress. The very passion and love for the valley that drove him to run for office 27 years ago fuel his work in Washington today. An engineer by trade and a former small business owner, Representative Cardenas's experience prepared him for a life of problem solving as a public servant. Congressman Cardenas currently sits on the House Committee on Energy and Commerce and is a member and leader of several caucuses, including the Congressional Hispanic Caucus. Representative Cardenas earned his engineering degree from the University of California, Santa Barbara, and was born in Tacoma. He was raised with 10 brothers and sisters, and they all still reside in the San Fernando Valley with his wife, and he still resides in the San Fernando Valley with his wife, Norma, their children, and their grandchildren. AFSP was honored to recognize Congressman Cardenas with the 2023 988 Crisis Response Champion Award and with the AFSP's 2024 Allies in Action Congressional Award for his leadership on suicide prevention throughout his time in Congress. We have been honored to recognize him for his leadership in support of the 988 Lifeline, including as chair of the Congressional 988 and Crisis Services Task Force. It is with my deep pleasure that I welcome Congressman Cardenas to share remarks. Thank you very much.
Thank you very much. It's a pleasure to be here. It's wonderful to see all of you who are so dedicated to making sure that not only are you saving lives, but making sure that people improve their lives as well. Appreciate that introduction and thank you so much. I also want to say thank you to my colleague from back in the 1990s in the state legislature, Grace Napolitano. We served together for quite some time now, and we happen to be leaving Congress at the end of this year together, and it's been an honor to work on many issues with my colleague Grace Napolitano, but more importantly, she's been our champion in Washington when it comes to whether it be suicide prevention, mental health in general, et cetera. And so I've been honored to work with her on these issues. One of the things that I wanted to mention today is that 988 isn't just a number where people can call. Every single day it's improving and getting better. For example, when 988 kicked off 2 years ago, the wait time was on average across the country was well over 2 minutes. Now we have it down to less than 30 seconds, closer to 20 seconds is the wait time. That's the kind of effort and improvements that we need to see continue to happen. And the only way we've been able to do that, as was mentioned earlier, I'm on the Energy and Commerce Committee. On that committee, we have jurisdiction over things that have to do with phone numbers like 988. And I've been fortifying and making sure that we fund upwards of over $500 million a year, in some cases over $1 billion a year for the last 3 years to make sure that we can fortify the system and make it as responsive and as effective someday as 911 is for everybody across this country. So I just wanted to say there's a lot more that we're doing in Washington, D.C. A lot more work needs to be done, but we've made tremendous progress. And once again, thanks to leaders like Grace Napolitano. So thank you for giving me the floor, and thank you for that wonderful introduction, and I look forward to the discussion.
Thank you so much, Congresswoman Napolitano and Congressman Cardenas. We are so grateful to both of you for joining us today. I am Emily Filtrin, Senior Director of Federal Policy and Advocacy with AFSP, and we thought it would just be a really wonderful opportunity today after hearing your inspiring remarks, to ask some questions in sort of a roundtable style that will then be followed from any questions from our audience. So the way that we have designed things today is that each of you will have the opportunity to answer each of these questions. You should feel free to build on each other or provide any other information that you think would be helpful for our advocates and members of the public who are joining us today to know. Our first question I'm going to pose to Congresswoman Napolitano. Congressman Cardenas, I'll then ask you the same question. So the first question, what do you see as the top priorities and biggest obstacles to creating and implementing policies that prevent suicide and improve mental health over the next few years? How can we work to overcome any challenges? Congresswoman, I'll kick it over to you to start.
Well, it's important to know that we have making mental health a priority has come a long ways, but still remains misunderstood, underfunded, and still affects millions. We've got to reach the undocumented, underserved communities. We continue to see a rise in reports of loneliness, stress, anxiety, depression, and thoughts of suicide in many people. And we got to continue the outreach, the city councils, the state assemblies, to areas that can reach to the underserved. And we've got to make sure that Congress appropriates enough funding and makes mental health a priority, not just kind of a sideline. It's important that Tony, you've done a great job in 988, and I congratulate you. You've been wonderful. Now, two of the biggest priorities, the funding and the reaching underserved communities, is so important. I can't stress it enough. We've increased the funding of mental health services since the start of COVID in 2020. We must continue to build on these numbers, and because our communities rely on the funding, and we got to start thinking about education of children at a young age to understand what it is, to be able to speak up, and also fund training for people to get into the mental health field. We continue to ignore the Latino communities, and we must further identify gaps in access and include participation of both consumers and community members in the development of the policy. While we include stakeholders and the decisions, not just elected officials, they've got to reach out to people who actually are suffering, like in the universities, colleges, schools, high schools, even middle schools. So there's still a lot of work to be done.
Thank you. Thank you, Grace. And I think it's really important to understand that the Affordable Care Act, when that law was passed, it required insurance companies and health providers across the country to give parity, equal attention to not only physical health, but mental health. Mental health has been something that has been a back burner, as Grace Napolitano mentioned. And what we need to do is make sure that we enforce the laws and also educate the people who do have insurance, educate them to realize that they need to challenge their insurance companies, their healthcare providers, to provide that mental health access support that they have the right to have. And that's something that I've been doing on the Energy and Commerce Committee. There's only two health policy committees in the House of Representatives, and one of them is on a subcommittee on health in the Energy and Commerce Committee. And I've been on that committee for 10 years. And along with my colleagues, we have all been pushing, both Republican and Democrat, to make sure that we enforce and force the insurance companies and healthcare providers to give equal access and equal attention to mental health and not just physical health. So again, the law is already on the books, but we need to grow it into a place where we see equal access. If you go to the doctor for a physical ailment, you should be able to go to the doctor and get the same response from your provider when it comes to a healthcare a mental health situation. So that's something that a lot of us are working on. And I'm here to report to you that more and more every day, we're getting both Republicans and Democrats on both sides of the aisle to be pushing for that and also strengthening the laws and requirements for them to actually enforce it.
Hear, hear. Thank you both for those really insightful comments and all of those issues that you touched on today. I know so many of our advocates are intimately involved in. We had over 700 of our advocates submit comments on the parity rule that the administration had put out, really telling their stories and bringing it back home. And it is, as you say, a bipartisan issue. And as Congresswoman Napolitano was talking about, training, really getting, the needs of youth met as well. AFSP has a new Talk Save Lives program that targets or is dedicated to our Latinx communities and Hispanic communities. So lots of intersections there, and really appreciate you bringing up all of those really important things that so many of us care so deeply about as well. And Congressman Cardenas, I'm going to start next with you. The next question is about collaboration. What kinds of collaboration do you see as the most successful when it comes to suicide prevention and mental health? How can organizations, agencies, and advocates come together to effectively create change? I think this builds really nicely on your comments about bipartisanship and working together through the committee. So would love to hear any other thoughts you might have.
I think one of the things that we need to be focused on, there are grants, both at the federal level and at the state level. And a lot of times at the county level, there are opportunities for organic community-based organizations, not only to educate themselves and to be partners in implementing mental health awareness, mental health support in our schools, in our communities, with not-for-profit organizations as well. It's important to understand that it's for example, when it comes to the Latino community, there's a stigma of admitting that you need to seek help because you're going through a mental health crisis or what have you. A lot of times, unfortunately, it's even one's family members who try to discourage them from getting help. So it's really important for us to understand that when you have like promotoras or people within the community organically who know the people by their first name, to be able to let them know it's okay to seek help. If your son or daughter is saying that they have suicidal tendencies or what have you, it's in no way a place to get mad at them or disappointed in them. It's an opportunity to support them. But also it's important not just to support them emotionally, but make sure that people understand that there are resources out there. Many times there are actually resources on their child's school campus. Again, not enough, because we're still getting there till we have true parity in it, paying attention and giving resources and attention to mental health needs. But the thing is, it's really important to understand that I think the most organic thing that we can do outside of what we're trying to do in Washington is make sure that local individuals know that there are support systems within their own community that can actually help them to actually get the mental health services that they need. And sometimes it's just right around the corner. But people need to be aware of it, and people need to spread the word.
Great. Thank you so much for those comments. Congresswoman, did you want to build on those or provide any other remarks?
Yes, Tony makes good points, and essentially is reaching out to elected officials to put on the website, to talk about during council meetings or any meetings, to get the word out that there's no stigma to ask for help. And I would suggest that they start building up on advocates. I had a consortium of mental health advocates in Mia St. John, 3-time world boxing champion, female champion, on several other people. And they spoke openly. In fact, at one time they had it on the buses, the issue of mental health stigma. So we need to reach out any way you can, use any kind of help that you might get from anybody, and reach out to Latino organizations like the Zacatecanos and some of those people so they can understand that it affects them too. I'm sure they know it, but they don't get reached out to.
Great. Yeah, that brings up such important points about both trusted messengers and the important work of community organizations and peer-to-peer work and families and all of that. Thank you so much for those comments. I know at AFSP, many of our chapters, we have over 70 chapters around the country, as you both know, and have been working on many creative efforts about getting the word out about, mental health and suicide prevention, including 988 on student ID cards and all kinds of things like that, that I know you both have been involved with at the federal level as well. So following up for our next question, Congresswoman Napolitano, I want to ask about the new national strategy for suicide prevention and how our advocates can get involved. So with the launch of the national strategy earlier this year, what role can Congress play in supporting this roadmap that's laid out in the strategy? And what are some ways for volunteers and advocates to get engaged at the federal, state, and local levels to promote this strategy and suicide prevention in their own communities?
Well, it is very important for federal agencies to work together with all the organizations and develop concrete recommendations how to address mental health and suicide prevention, which the national strategy puts forward. Congress can play a very important part, but you've got to make sure that you ask all members of Congress to participate to make sure that it has support on both sides of the aisle, and make sure that they provide funding to address these recommendations. Advocates play a vital role by getting the word out to who to call, who to address. Must educate the community about the strategy and make sure that they know where to reach that information by providing feedback to both federal agencies and Congress on how the strategy is working, where it needs to go or doesn't need additional funding. We know that it is not fully funded, and that's how we look forward to making sure that we promote that at every level. To increase the funding is real critical.
Great, thank you for that. Congressman Cardenas, did you have anything you'd like to add on the national strategy?
I think it's important for us to remember that a national strategy is important, and we have a better, more comprehensive national strategy today. We have more people in Washington who have been affected by serious mental health issues within their own immediate family, especially after COVID-19. You have people, again, of all walks of life. Doesn't matter how wealthy you are, doesn't matter how challenged you are financially, you know somebody who actually admitted that they were going through some serious mental health challenges during COVID-19. So what that has done, fortunately, it has created more Republicans and Democrats, elected officials across the country at every level of office, who actually now realize this isn't just somebody else's issue. This is an issue that has faced them personally. I think that is, fortunately, unfortunately, that is the best impetus for elected officials to finally pay attention to things and to actually help fund them and actually help address them with better policy, more comprehensive policy, and with more support from everybody involved in whatever body of elected officials they're in. Thank you.
Great. It's really inspiring and very helpful. I love hearing about all of the different ways that people can get involved. And, really here at our policy team, we talk about, advocacy. There's many different ways and many different roles for people who want to be an advocate or, speak out for mental health. Many people, may not even identify with the term advocate, but may want to get involved or see themselves in the national strategy in some other way. So thank you so much. So moving on. Oh, yes.
I just want to say that my mental health consortium was formed maybe 20 years ago. And it started off as nursing and went on to mental health. And I'm sure anybody can start one for suicide prevention, because it is prevalent and it's important for them to know how to reach out and the providers, so they can get the word out of who they are and where they are, so they can contact them.
Right. Great. Thank you for that. So we're moving on to our last question of our pre-planned questions, and then we'll have some opportunity for any audience questions. And so just as a reminder to our audience, you can enter your questions in the question box that you see on your screen, and we'll receive them here and get to as many as possible. So finally, Congressman Cardenas, I'll ask you this final question and then pose it to Congresswoman Napolitano. Looking ahead, getting to that looking ahead part of the title of our session today, how can advocates have an impact on legislation impacting suicide prevention and mental health? What are some of the best ways that they can really have an impact, get their voices heard from members of Congress and other elected officials?
I think the most effective way to do it is actually to visit with the members of Congress. You don't have to fly all the way to Washington, D.C. For example, I'm in my district office. I'm assuming, Grace, that you're in your district office right now. or you're in your home district. So the thing is, you can have local individuals, especially children. Children, it's so suicide is so prevalent amongst our young people, and nothing's more touching to an elected official who's an adult to hear the true story of a young person as to why, how, and where they're at mentally, and the kind of support that they need. I think that's the best thing that we can do as community members, is to make sure that we actually let them know how organic it is, how prevalent it is, and how important it is that we do what we can with our policies and with our funding to help people with their mental health challenges. So I think by example is what I'm saying. Bring people of all ages, especially young people, if they're willing to tell their story, because when you do that, you have a higher likelihood of touching that individual that you're trying to get and enlist their support, both with their policies and their financial support and their personal commitment, to make sure that they are aware how important it is that all of us work on advancing better solutions to our mental health challenges.
Great, thank you so much. And Congresswoman, any thoughts about how our folks can have an impact?
Yes, Tony, you're so right. We started mental health in schools like 21 years ago. And it was important because we see that a child at the grammar school level can grow up with mental health problems later that were being exacerbated by time and no help. And we find that some of the schools send their students to the schools that provide mental health services now because they know they need it. And if the mind is clear and is sharp and is well, then the body reacts to it. We think that it's important for children to be addressed at an early age. Advocates must educate the schools, their city council, the county and the state, and the federal electeds of the importance of mental health and suicide. It means a lot to some cities that now have the program and are not having to deal with the issues that they had before. My office regularly hear from residents, advocates, businesses, and local governments regarding mental health via meetings, phone calls, and emails about the policy. It's important to hear from these groups because they see and work the issues every day. But you've got to make sure that they understand that there's help for them and be able to provide them with information that will address the issues they have. At the end of the day, these are the people I represent. And the Mental Health Consortium is a dedicated group of mental health professionals, and you can start your own just by beginning to reach out to the providers like yourselves and have small meetings, and it grows because people see the value of it. And that's how I think we should address some of this issue.
Great, thank you so much. Your remarks are just so thoughtful, and it's so clear that you are friends and colleagues, and have really worked so in so many different ways over many years on suicide prevention and mental health. And we just so appreciate all of your remarks during our roundtable discussion. We're now going to move it to sort of more open question part of our program, where we invite our audience to ask any questions they might have, and we'll receive them here as staff and read them aloud, and we'll get to as many as we can, and then see where we're at after that. Okay, we do have a few questions here. Thank you both so much for your time as we go through these. I think I'll start with this one. Congresswoman Napolitano, this seems to be a good way to pick up, as you were just talking about some of the ways that you recommend people get involved, locally. There's someone who asked a question. They run a nonprofit named after their son called the J. Holman House that supports suicide loss survivors. And they're wondering how they can become part of the solution.
Well, they should get themselves known to their surrounding communities that address mental health services. and be part of the solution. Because the more they get the word out to other folks that deal with mental health, the providers, the supporters, the advocates, the better off their chances to get more work done. And I would suggest that they send us information and we can spread it out our way. And I'm sure Tony would do the same thing about them. See, there are a lot of organizations out there or startups that have advocacy, but we don't know about them. So we've got to make sure that everybody else knows about them so we can refer people to them or likewise be able to help them.
Great. Thank you for that. This next one is for both of you, and I think it's a fun one because it reflects your leadership on a couple of important pieces of federal legislation. So what actions can individuals on this Zoom or otherwise take to help to ensure that both the Local 988 Response Act and the Mental Health Services for Students Act pass this year?
Well, it would be to write or call the members of the groups that are now looking at the bill and inform them of how important it is to have this legislation passed. I know that the one bill is only one of many they're looking at, but it's an important one. Kids need the services and we need to provide them, but there's got to be more funding to provide services. And I know that some of the providers say they don't have the trained staff. So we need to ensure that we also ensure that education is provided, the funding is provided for education to put people in the queue for mental health services.
And also what people can do, people on this call, try this yourself. If you're at in a gathering with some family members, you happen to be somewhere with some friends or what have you, ask them, do you know what 988 is? And you'll be surprised how many people don't know that 988 exists. Right. Good people, hardworking people, people who care about mental health, they might not be directly involved in the mental health space, but I'm always surprised at how many people don't know that 988 exists. 988 is available to anybody in the country, just like 911. But you don't want to call 911 when somebody's having a mental health crisis. Everybody on this call knows that. So what everybody can do is to make sure that people understand, people around them, be the ambassadors of 988. And that will probably spur on other conversations about how important it is for people to understand mental health and how prevalent it is in everybody's life. So I think just spreading the word about 988, that it's active, that anybody can call. You don't even have to write it down. It's easy for people to remember. So I think that's one of the most effective things that people can do right now. And then once people start to realize that 988, how important it is, the fact that it exists, they'll hopefully little by little start getting involved as well, or ask how they can get involved.
And it isn't just big things. They should call 988 for any issue they have with mentality, any question they have on their own that might lead to suicide.
Mm-hmm. Yeah.
Great. Thank you so much. And as your remarks say, this isn't about what political party you are. This is anybody, and suicide and mental health affect everyone. And with that, we have a question related to, we all hear there's gridlock in Washington. What really works to make sure that suicide prevention remains a bipartisan issue?
Gee whiz, you talk to the speaker, so you can put the legislation forward. It's up to them to make, whoever is in charge determines what comes to the floor, and that's their charge. And we need to spur the Republicans. All Democrats are on our side. They are pro mental health, but the speaker doesn't allow bills to come to the floor or to pass in committee. Tony?
Yeah, well, Grace Napolitano is absolutely right. These are good pieces of legislation. It's one thing for members of Congress to say that they support it, but it's another thing for them to actually act and actually give it an opportunity to be voted on. And that's something, that's the only way the bills can advance, is if the speaker allows those bills to come to the floor for a vote, up or down, whether they pass or not. I believe that if the speaker did put those bills on the floor, they would actually pass, but it's up to the speaker to do so. Those of us who are members of Congress are doing what we can to ask the speaker, pressure the speaker, remind the speaker how important it is. But it always helps when constituents in districts across the country ask for the bills to advance.
Great. You really set us up well for this next question that just came through, although it has more to do with the influence that they can have on individual offices rather than the speaker. But we just got a question from the audience. You both have seen advocates come to your offices for years. Are there certain tactics that you think are especially effective from advocates to, your staff or yourselves that are underutilized?
Well, one of the things I would imagine is tell the member of Congress that they have 5 persons advocating for it, and those 5 persons can reach 10 each, and then so on to build up like a pyramid, because they count numbers of votes that get them elected. So you got to make sure that you tell them the people are looking at it from a standpoint of necessity, and what are they doing about it?
Yes. Again, grassroots is the best way for people to get involved. The sincerity is already there. You already care about mental health, but what you need what I know what all of us want is to make sure that we have a robust system of mental health care and access. And the only way that we're going to do that is that if people at the county level, at the state level, at the federal level, they actually advance local programs to all the way up to federal funding to make sure that we can actually have more access. So the most effective things to do, like I said earlier, is those personal stories. Talking about somebody in their family or that individual themselves, speaking about what their mental health challenges have been and how important it is that they're still here because they were able to get the support in their local community or from their provider. One thing I'd like to give everybody some advice, especially those of you who are from California, our Senator Alex Padilla, his wife, Angela Padilla, created a not-for-profit called Fundamental Change. So Alex Padilla knows firsthand what it's like to have an advocate in his own home. And also, Angela is very open, and her mother is as well. Her mother has a serious mental health condition, who, thank God, has been diagnosed. And again, this isn't something I'm speaking out of turn. Angela's mother, the senator's wife's mother, his mother-in-law, has a serious mental health condition that is now it's under control because of finally getting diagnosed, finally getting the help that she deserves and needs. And so Senator Padilla is an incredible advocate when it comes to mental health, not only for Californians, but for everybody in the country. So just a little tidbit there. If you want to name drop, when you're meeting with somebody in Congress or your county supervisor or what have you, let them know that there are people like Senator Padilla who are tremendously supportive of making sure that we all try to create better systems of access and better systems of care.
Great. Thank you so much. And we really value Senator Padilla's leadership and his wife's work as well. And of course, Senator Padilla is a co-founder of the Senate Mental Health Caucus. We work very closely with him. So I'm going to give one last audience question, and then we'll wrap up this portion of the program, and I'll hand it over to my colleague, Joanna. So final question, what is your proudest mental health accomplishment during your time in Congress?
Well, my most one is bringing mental health to the forefront when nobody wanted to talk about it. Nobody would even give it any time because of the stigma. And we've worked to kind of reduce it. It's not eliminated yet. The stigma has got to be eliminated. And we've got to make sure that everybody understands that to seek help if they need it. And I think that has been my goal, is to bring mental health issues to the forefront and have forums for people to bring them out in the Congress.
One of my most moments that I appreciate reflecting back is Seth Moulton used to be a Marine. He's a congressman now, and he actually is the one who actually got 988 legislation to the president's desk for the creation of 988. But my part is he's not on the committee of jurisdiction when it comes to 988 and formulating it through the Communications Commission. And so I was glad to take on the mantle of making sure that we not only made sure that 988 got up and running as quickly as possible, but made sure that the funding went through to support 988 and the creation of it and the fortifying of it across the country. So that's been my clearest recollection of how I've been able to do my part when it comes to mental health.
Great job, Tony.
To both of you, truly amazing accomplishments. You know, we know the tremendous impact that you both have had, and it's just wonderful and really a special moment to hear from both of you about what you see as some of your proudest accomplishments, because we know that list is long. So thank you so much for your remarks and your reflections. I now will turn the floor over to my colleague, Joanna Rosen, Manager of Federal Policy with AFSP, who will provide some information on AFSP's advocacy resources, how folks can get involved, and some closing remarks. Thank you.
Well, thank you, Emily, and thank you, Laurel.
Thank you.
Thank you so much.
Joanna, the floor is yours.
Thank you, Emily. And thanks again to our champions, Representative Napolitano and Representative Cardenas, for their time today and their dedication throughout their careers. It's always been a joy to work with them and their staffs as well. So I just want to recognize them. In the spirit of carrying on their critical work on mental health and suicide prevention, I want to point you towards some resources that may be helpful if you'd like to get involved with AFSP. I believe we're going to have that up on the screen shortly. You can sign up to be an advocate and get updates and information on the federal and state policy priorities that we work on through our advocacy page, which is that first link. And our action center, which is the second one, will help you reach out to your elected officials to voice your support for some of the bills mentioned today. Additionally, you can learn about our more than 70 chapters and their upcoming events, including walks and advocacy action days, where we can reach out to our members of Congress and our state legislators to request their support on really critical suicide prevention programs and policies. You can also check out if your representative is a member of the Congressional Mental Health Caucus, which I know was mentioned today at this Action Center as well. And you can learn more about the caucus and their work here at the third link right there, which again, we can drop in the chat for you all. Thanks again for joining us today and have a wonderful rest of the afternoon.